So I'd really like to thank Uncle Chris Tobin and Nairi for their wonderful welcomes to country, and also like to add my own particular welcome to any Aboriginal or Torres Strait Islanders people here joining us today. So I love this little image of the Australian healthcare system. It comes from the Department of Health. Lovely concentric circles. It's an idealistic way that patients transition between different parts of the health sector, and there's some externalities to it, but that's the lovely fluid system. And then if you look at this picture from the AIHW on who funds what and who's responsible for what you really see is this just incredible mosaic of different people who are responsible in interconnectivity for the health system. And all of that, on top of all of that, is laid a layer of policy. Now, when we move to the environmental footprint of healthcare, we lay on top of that another layer of policy from the environment, starting all the way up at the governmental level, where they plan to create a new office, and they've released plans to drive us to net zero, which is great. Every single state and territory has a climate adaptation policy. There are also sector adaptation policies. There's Department of Health policies, which may or may not mention climate change, and so on and so forth. There's also some really exceptional resources from non-governmental organizations that individuals and organizations can access to make changes within their own systems, which is fantastic. Except for the fact that what we end up with is this incredible convoluted knot of good things and bad things all mixed together, hiding somewhere in the middle a sustainable low carbon health system. So how do we cut through that Gordian knot and actually achieve this promised low carbon, better value healthcare system? Well, one proposal is a learning healthcare system. So this is a model where rather than evidence taking 17 years to get into practice, it is rapidly integrated into the way that we treat patients, and it informs the very next patient to provide better care. So it's envisioned as this cycle. So you start out with incredible amounts of data from patient records and research, and then you bring that together to create knowledge about what works for whom and when within the system. You bring in new communities of practice to help inform what would be better care that improves our performance, and we move on to the next system. And it's kind of envisioned as from a patient-centered perspective, but we could also look at it from a carbon footprint and health services perspective, where we take not just what happened to that patient and what care pathway did they go on, but how much carbon did it take? Is that the most efficient pathway to take? And looking across all the externalities from the shipping and the energy and such, to create better performance in the system and bring in new communities of practice that will improve our system. So what do we need for this? One of the big things we need is joined up science and technology. At the moment, we have data in little silos. The systems can't talk to each other. People can't access them. Research just sits in journals, completely inaccessible to most of the people who provide healthcare. The reason that we don't have, like my health record hasn't worked very well, is we don't have that trust and that co-design. So we really do need it to be patient-centered care, where patients understand why they shouldn't have a test, why that actually has a bigger, broader impact beyond themselves. So we can do joined up care. And of course, one of the biggest things we need is a continuous culture of learning. So where we will introduce new programs and see how they're going, and disinvest from things that are not working, and scale up these programs. And of course, to have that, we have to have financial and policy incentives that are all aligned and working together. And ultimately, we also need funding for health services and implementation research, so we know which is which. We know which one we should keep and which one we should get rid of. And what we're hoping for is this sort of continuous cycle of learning, where we bring in new ideas that work and disinvest from ones that don't work. And as we can move through the cycles, what we're hoping for is that we get not just great change in one place in Melbourne, but that is actually scaled up across the system, and that Queensland can replicate it and Australia can replicate it, and we can do international learning, which is actually really part of what we're trying to do today. Thank you.
Thank you, Yvonne and K-lynn. Starting the process in my head of getting us to the panel discussion and starting to think, how do we pick up some of these great solutions?